With the second COVID wave spreading at a menacing pace, there is an increasing clamor for a complete national lockdown. From the Supreme Court to top American epidemiologist Anthony Fauci to the director of India's most prestigious medical institute, the All India Institute, Dr. Randeep Guleria, they're all advocating a far more aggressive national lockdown than what we have at present, where we're dealing with more localized containment measures. Here's a look at this day's top story, and then we look at the pros and cons of whether a lockdown can indeed help break the chain.
Members of the Dr. V.K. Paul-led COVID-19 task force have asked for a pause for the healthcare system to be improved, for oxygen beds to be readied, to break the chain of transmission from urban to rural India, and to give a breather to the country's healthcare workers collapsing under the burden of work or succumbing to COVID-19. Among the advocates of a tighter lockdown in districts reporting more than 10% positivity rate is Dr. Randeep Guleria. Members of the task force have told the Prime Minister that a complete lockdown is required. Dr. Anthony S. Fauci, Chief Medical Advisor to the Biden administration, has also advocated the same, asking for a window, critical, immediate, intermediate and long-range steps out of this very difficult and desperate situation. Among other steps, the most credible voices in the world, like Dr. Anthony Fauci, say India needs to build makeshift hospitals, bring in the army to help, get the medication in place, get PPE kits, and get the vaccination program rolling. Doctors, desperate and tired, some even traumatized, have asked the government to pay heed.
We doctors in India are totally burnt out physically and mentally. And there should be a complete lockdown for 15 days, not only to break the chain of this infection, but also for the augmentation of the various health requirements, especially oxygen supply and various drugs required.
The Indian Medical Association says 110 doctors have died in the second wave of the pandemic already. But is a complete lockdown the solution? No, say some epidemiologists who have also been members of the Lancet Commission on COVID Task Force and have asked for localized responses.
There are some areas with high, some with moderate and some with low transmission areas. We need to identify these areas and reduce the speed of transmission, especially in areas with high transmission, by doing local lockdowns or regional lockdowns. So therefore, having national lockdown will not be useful in reducing overall.
In spite of the desperate situation, even as of today, sources within the government indicate that they are not keen on a nationwide lockdown. Health Ministry sources also seem to suggest that targeted intervention is what should really work for India. A nationwide lockdown has huge economic ramifications, and in spite of concerns that this infection is spreading now to 2-tier and 3-tier cities and even deep into rural India, the government really is not in favor of a complete lockdown, the kind we saw last year. In New Delhi, Sneha Mordani for India Today.
Will a national lockdown help? Will it help break the chain of transmission? Will it help build adequate healthcare capacity, or at least augment our healthcare capacity? Or will it just delay the inevitable? Because once the lockdown goes, a few days or few weeks later, unless we've been able to scale up substantially, the virus will start traveling again. So this is a very complex question, and I want to spend some time focusing on the pros and the cons of a national lockdown, which is now being suggested by the likes of Anthony Fauci and Randeep Guleria. I want to welcome to the show, first and foremost, Dr. Arvind Swain from the Medanta Institute. He believes that a lockdown is required at this time. He'll explain why. Countering him will be Dr. Sanjeev Bagai. Two contrarian voices in the form of Karan Bhasin, who believes that, the economic consequences of a lockdown are not greater than the medical consequences, and therefore, just because of the economic devastation, a lockdown doesn't serve a purpose. To counter him, we have Dr. Swapnil Parekh, who's an author, a medical expert. And last but not least, for a perspective on the current thinking within the Bharatiya Janata Party government at the centre, I have its spokesperson and member of parliament, Syed Zafar Islam. I want to go first to Swapnil Parekh and get him to explain at the outset the rationale for why you believe a national lockdown at this stage is what India requires.
Currently, the situation we find ourselves in is one where our health system is entirely overwhelmed. And it's very pertinent to remember the time lag between when new infections occur and when these infections translate to hospitalizations, and sadly, when some of these individuals perish. The current load on our health capacity, the current number of mortalities that we are seeing, these represent infections that have occurred a few weeks ago when the numbers were much lower. We know that the numbers have increased exponentially since then. Our ability to find cases is limited by our testing. So in a few weeks, we're going to see hospitalizations and deaths due to the infections that have occurred today. Even if there are no infections from tomorrow onwards, and of course that's not possible, but even if that were the case, our health system still has to contend with all the infections that have occurred till today. And we already are struggling. Our health system is already broken. So we urgently need to reduce the number of infections. And unfortunately, we have backed ourselves into a corner where a socio-economically difficult lockdown is our only tool that can preserve health capacity. And it must be accompanied by economic packages to prevent financial ruin for the most impoverished Indians.
Okay, I want to go across to the Corona India dashboard and show you the picture as it exists at this moment. And then I'll go across to Karan Bhasin to get him to explain why he thinks a lockdown is not the right way to go. Now, if you were to look at the India daily numbers at this point in time, you can see the graph in India is shooting straight up. There is no question about the fact that we have a hockey stick like situation where the trend line is alarming. It's a very, very exponential growth that we are seeing. Maharashtra continues to top the list of states where maximum cases are being reported, followed now by Karnataka, Kerala, Uttar Pradesh, and then Andhra Pradesh. The number of deaths is increasing as well. The number of deaths in the second wave of COVID, much more than the number of deaths in the first wave. Overall, we've had 218,959 deaths. If you were to look at the manner in which these cases are increasing, it's very clear that we're nowhere close to a peak at this moment. So if things stay the way that they are at present, going forward for the next several days, if not weeks, the number of cases across the country is likely to continue increasing. The hotspot may change. So at this moment, Maharashtra's trend line is coming down, Karnataka is going up, Kerala is going up, Uttar Pradesh is going up, Andhra Pradesh is going up. So the states that are impacted could change, but in reality, the number of cases will continue to rise. And therefore, Karan Bhasin, medical experts are now coming around to the view that a national lockdown is all but inevitable. The sooner you do it, the better, because you can arrest the chain of transmission faster. You delay it for a few more days, there'll be more cases, more deaths, and ultimately later you'll have to take the same decision. Why are you opposed to this, Karan?
Thank you so much, Rahul. And utmost sympathy, and we are going through a frightening time, and there's no denial that we need to do something. But my fundamental issue with the lockdown is that the basic premise that lockdowns will stop or break the chain is fundamentally not true. And the reason I say it's not true is because we have looked at the data available from 110 countries, and out of them only 10 countries have managed to break the chain due to a lockdown. Let me give you an example. Delhi has a lockdown, and we know what's going on over there, right? Another counterpoint that I have is that if you look at the mobility indices, our mobility indices indicate that the mobility levels in India are similar to what they were during the lockdown. Yet cases are increasing, and they're increasing at a faster rate. So we cannot be certain that imposing a lockdown will reduce cases, because evidence suggests that it doesn't reduce cases. And there's a lot of global evidence to point at this. So in such a scenario, when you know that lockdown may not break the chain, then how fair it is to impose severe economic costs onto the poor and vulnerable. more importantly, people think that lockdowns will help us build capacity, but the contrary is actually true, because what lockdowns do is they disrupt the supply chain. And when supply chains get disrupted, they take 3 to 4 days for essentials, and even for certain non-essential medical supplies, it takes up to a week or 2 weeks to be able to restore them completely. So at a time where our healthcare capacity is already choked, I don't think it is rational, so to say, to disrupt the supply chains, because that will lead to far more severe problems than the one that we are facing right now.
Arvinder, Swen,
We've
Karan
had
arguing
lockdowns.
persuasively that a lockdown, instead of helping, may end up damaging India's case at this moment, because supply chains get disrupted, you're not able to augment capacity. Why is it that you believe that the level of containment needs to be far more than it is at this moment? Why is it that you think a lockdown is what we require?
Rahul, partial lockdowns, night curfews, or lockdowns only in areas which have high infection rates are good theoretically, but practically they don't work. Because you've seen that despite weekend curfews, despite weekend lockdowns, in several states, the infection is on the rise. Now, lockdown has worked for some of the countries. Lockdown has worked for Mumbai. The Mumbai numbers are coming down. The problem is that if you have different rules for different people in different areas, you need a very complex digital dashboard kind of thing, nationally, to monitor what's happening where. And that's not really feasible at this point. Besides that, the doctors and the nurses, the healthcare workers are already burnt out with hard work, with actually having the disease themselves, and actually having to deal with their family members having the disease. So really, we need a breath of relief among the healthcare workers. The oxygen supplies will obviously be bolstered to a level that's acceptable in a couple of weeks, which hasn't happened so far. And hopefully the supplies of essential drugs will also be eased out over the next 2 or 3 weeks, because international help is on its way. Domestic capacities are being ramped up. So I think that initially, the lockdown last year was done to get the healthcare system in order. This time, it's definitely firstly meant to break the chain of transmission. What is transmission? How does disease go from one to the other person? What is R? R is the value at which one person infects, the number of people. And if it's more than 1 or 1.2, the rate of infection or transmission is rising all the time and creating the numbers that we see. But if the R falls, and how will the R fall? It's only when people stop interacting with each other. So I think that obviously lockdown, nobody wants to hear the word lockdown. I don't want you to go back thinking this doctor wants a lockdown. No, we are forced to enter that period, maybe 2 weeks, 3 weeks, 4 weeks. It's an emergency measure for countering a disaster of the worst kind. And there is no other option.
Dr. Swen says it's not as if he's very keen that there be a lockdown or looking forward to it. But given how overstretched the medical healthcare infrastructure is, given the fact in 2 or 3 weeks oxygen situation should stabilize, there will be oxygen readily available. Therefore, use that time to create more ICU beds, bring in more oxygen. Until then, just lock everyone up.
Good evening, Rahul. Good evening, everyone. So let's look at it in a rational, scientific manner. We are not talking emotionally. We are not talking that doctors are tired. Of course, we're tired. We are absolutely dead tired. Now, this after 15 months of this pandemic globally, and more so in India now in the second wave, to have a comprehensive pan-India lockdown is like throwing a nuclear weapon on India. What we need is a more deft touch. We need to recalibrate our strategy. We need to avoid the 3 C's, which is, it's a cliche, crowds, closed spaces, and congregation. But the fact is, we have to do the 3 C's, which is increase the coverage of the vaccination, do containment at a microgranular level, and continue to do genomic sequencing. Now, let me tell you why the lockdown will merely serve as a superficial purpose at the present moment. We know, and I'm quoting worldwide data with references, with statistics, 4 to 8 times is the indoor transmission now of the mutant strains. More than 55% of worldwide transmission actually now is happening indoors. So by keeping people closed down inside, we are not going to break the chain of transmission. We are only delaying the inevitable. Point number 2 is we have not done enough genomic sequencing to know which strain we are dealing with. I'm giving you today morning's data of UK and Israel, two countries which have done the maximum genomic sequencing, and they have now the least number of cases and hospitalizations and deaths. What we need to now focus on is recalibrated strategy as public health. We have to push the vaccination like never before, but we must know which strain we are dealing with.
Dr. Swain, counter what Dr. Bagai is saying, everyone who's watching at this time will know of families who've been locked up at home, haven't been stepping out, have not even had their staff been stepping out, and yet have ended up with COVID. And therefore, if that's the case, Dr. Bagai questions whether a lockdown will indeed serve any purpose in helping break the transmission.
First, about the variants. The variants are not directly related to the lockdown or the surge in it. It may be related to the surge in infections, but that surge is not going to be contained whether you do or don't do a lockdown. If it's a different variant that is infecting people where the transmissibility is much higher than the wild type Wuhan strain that we know of earlier, then a lockdown may not help that. Or even not locking down is not going to help that. Genomic sequencing will only tell us that it is a different strain. And then people will get down to working out whether the vaccines that they currently have work against those strains in their laboratories, and then probably test it out on populations. So it's a slightly different point here about genomic sequencing. Of course, it needs to be done. We need to know why we're having this surge. Is it the normal strain or the variant strain? But that's not directly related to the lockdown. But the lockdown story is very simple. You have congregations that are responsible for surges of transmission. You don't have 3, 4, 5 people at home actually responsible for surges in transmission. So when you lock people down, you prevent by force any kind of congregation. And by congregation, I don't mean 3, 4, 5, 6 people at home. I mean the crowds that you've seen in the rallies and the farmers' protests and the Kumbh Melas and the festivities and so on. Those things will have to be cut down, not just at that level, but also restaurants, malls, movie halls, anywhere where there is a congregation. I mean, I may be sounding politically very incorrect, but I think that the timing to have the IPL now was not that good, because you see how many people are actually getting affected within the IPL teams. So you really need to shut down most of the activity for a few weeks to get up.
So let's go across to Syed Zafar Islam for a sense about the thinking within the central government. Opinion is split. There is no right answer now. That's the other problem. It's not as if going in for a lockdown will provide a complete solution, or not going in for a lockdown will ensure that, you know, livelihoods are not lost. Livelihoods are being lost in any case. The economy is suffering in any case. Go in for a bitter pill and recover sooner. What's the current thinking in the Bharatiya Janata Party? Syed.
Rahul, let me be very candid. It's not an easy task for any government to take a stand whether to go for a lockdown or not to go for a lockdown. You have in your panel, you have 2 doctors. Forget about the economists and the author, but you have 2 very renowned doctors, and both have a very different views. One of them is arguing very clearly and with the rationale, with a lot of statistics that and you will buy the argument that lockdown is something which is not warranted. The other doctor is also arguing that lockdown is warranted, and he is also giving.
No, but you're explaining the complexity of taking a decision. But the whole point of electing governments to power is to empower them to take a decision. So what's your thinking?
Absolutely, I'm coming to that. So that is the complexities which the government is dealing with. But let me tell you, the thinking in the government is that the lockdown is the last recourse. When you are exhausted all your options, then the lockdown can be considered by the government, and that is something which is very, very important. And the Honorable Prime Minister has very clearly stated that it is the last resort, if at all government has to consider it, because
no, but when do you press the weapon of the last resort? Okay, understood. It's a weapon, Dr. Bagai, as the government has said, the Prime Minister said so himself, of the last resort. But at what point in time do you think the water has gone over the head to an extent where you need to press the weapon of the last resort into action? What is that point?
Let me play the devil's advocate and actually say the exact reason. See, the spread of the new mutants is completely into the community now. I'm not going into the genomic sequence. These virus, apart from it being airborne and being have a much higher rate of indoor transmission, is already widespread into the community. By having a lockdown for 2 weeks, 3 weeks, 4 weeks, for how long? Now, Dr. Swine had mentioned that it's not going to help. Let me explain this to you. The new mutants now are being harboring and continue to shed for more than 32 to 35 days. How long are you going to lock up the country? And you know that these viruses are going to spread indoor too. What you are doing statistically is just delaying the inevitable. See the countries which had the lockdown in different phases of this pandemic, and all the meta-analysis, just by going by data, shows into the 16th month, when you had 15 months to prepare, whether we prepared or didn't prepare is different. And the super spreader events are just happening, and they're still happening now on Delhi borders. It's a pointless exercise. It will devastate the country, not only medically, socially, and economically.
Swapnil Parekh, respond to Dr. Bagai. He says you're only delaying the inevitable. How long will you lock down for? 2 weeks? What changes? 4 weeks? What changes? It's already spreading in the community, and it is spreading through indoor transmission.
I would push back very strongly against the statements that lockdowns don't work. For example, Wuhan did just one lockdown. They drastically suppressed transmission. When you actually look at lockdowns, they do work in reducing transmission. We have to be mindful that when we say lockdowns don't work, we have to define what we mean by a lockdown, and we have to define what we actually mean by whether it works or not. On a slight tangent, I think that perhaps if we had worried more about COVID-19 a few months back, we wouldn't have to worry so much about lockdowns today. But let me give you a few different scenarios. In the first scenario, we have a country that is very pandemic ready. They are educated about pandemics, and people follow the necessary protocols to avoid transmission, both the people and the government. In that scenario, a lockdown may not add much marginal utility. In a second scenario, a population is not pandemic ready, neither is the government, but when the pandemic hits, they get pandemic ready very quickly. Businesses aren't allowing indoor congregations. We stop the other events, mass events that lead to transmission. And in that scenario, we may say that, okay, a lockdown might work here, but other measures might also. And in the final scenario, you might have a population that's completely unprepared for a pandemic. And then you may have a government that, instead of responding to pandemic control measures, has mass congregations. In that scenario, you may have no choice other than a lockdown. We've also mentioned targeted lockdowns, we mentioned vaccines, but you need to remember that if you have targeted lockdowns, you need to have very tight borders. You can't have people moving from one area to the other. If you don't have containment in small lockdown areas, it won't work. And finally, we're talking about vaccines. Let's remember the vaccines takes time to kick in. So even if we vaccinated every single susceptible Indian today, which is of course impossible, we don't have the distribution to do that. We don't have the manufacturing to do that. We're already struggling. Vaccines are on the decline, are not increasing. But even if we vaccinated every single Indian today, partial protection would kick in 2 to 3 weeks later. Complete protection would kick in 2 weeks after the second dose. So trying to use vaccines to prevent a lockdown won't work. It would have worked if we had vaccinated, like our lives depended on it in January and February. But even if you look at UK and Israel, you will see that they had to lock down in addition to deploying vaccines at scale.
Okay, let Karan Bhasin respond to the point that you're making, that the example of countries in Europe and the United States shows that lockdowns do help in bringing the level of infectivity down to more manageable levels. That right now people are dying because they're not getting oxygen. If you lock down, after a while the number of people ending up in hospitals will come down, and therefore there will be respite. Till then you'll be able to organize your act, get some of these extra oxygen supplies in place, and then once you open up, at least there'll be more hospital beds and there'll be more oxygen available for people who need it.
No, so Rahul, I absolutely disagree with the point that the previous speaker made. And I want to present hard evidence to substantiate what I want to say, because the evidence is actually contrary. Out of 120 countries that actually imposed lockdown, it worked only in 8 countries, not in most countries. And those 8 countries were, countries like China and those who have very strong surveillance state. Obviously, that's not a strategy that you can implement in India. Look at UK. It imposed a heavy lockdown across for many months, but that didn't really reduce the number of cases because, a lot of people, and this is something that is taught in Stats 101, that correlation is not causation. So when your cases are picking up, when you're, at the peak, if you impose a lockdown, cases will bound to, reduce subsequently, and you would believe that they started reducing because of lockdown, but no, they would have reduced even without a lockdown, and that is exactly
No,
what
but that
happened in
is
Mumbai.
no, inherent to your argument is the belief that we're at the peak. But I'm saying we don't know where the peak lies. As
I
Maharashtra
agree,
starts
but
coming under control, Delhi starts stabilizing, the caseload is shifting to states like Karnataka, Andhra Pradesh, Tamil Nadu, elsewhere. So we're not close to the
you're
peak yet.
supporting my point, Rahul, because every state is peaking at a different level, which is why we need different strategies given the heterogeneous nature of a country. We can't go into a lockdown across the country, disrupt supply chains, and then wonder why aren't we able to expand capacity? Why aren't we able to ensure that there are adequate medical supplies in all parts of the country? That just does not work. Let me give you a very small example. When we did the first lockdown, and this is something that actually happened in a practical scenario, where transporters were not willing to supply medicines because they are small items and they are usually shipped with bulk products, right? So your entire pharmaceutical supply chain got disrupted for 3 weeks because of a national lockdown. Those are unintended second and third order consequences of lockdowns that people don't really see through. So the very fact that you're saying that a lockdown will break the chain, I think that's a very strong assumption, and there is very limited evidence to support that assumption in the first place.
Dr.
On the
Soin,
other hand,
respond to the argument that Karan makes that different states have different requirements. Maharashtra may not need a lockdown at this moment. In fact, it needs to start opening up possibly in a few days from now. Whereas other states like Karnataka, which are beginning to see the brunt of more cases, need to adopt a more aggressive containment strategy. So there is no one size that fits all for a country as complex as India, and therefore a national lockdown is a bad idea.
There is a presumption which is wrong, and that is that each of these states is a self-contained geographical unit. It is not. People keep traveling in and out all the time. In fact, that's the whole problem. I mean, why else do you think there would be not just 3 or 4 or 6 cities and states that would have the infection? Why is the whole country getting infected one after the other? So the other point that the gentleman made also actually supports what I'm saying. Because India does not have, let's say, a complex capability for making a dashboard where everything that's going on in every nookie and corner of the country is clear. That's exactly the reason why you have to do a blunderblast at least for 2, 3, 4 weeks to get your supplies in order, to get people to recover from the disease, the healthcare force to recover from disease, from exhaustion, and get the supply chain in order. Obviously, you cannot stop the supply chain. You cannot disrupt the supply chain of medical supplies. That has to continue.
So you're making the case, which is an important case, Dr. Bagai. Learn from the lessons of last time, because last time round supply chains for pharmaceutical products got disrupted. Doesn't mean you need to make the same mistake. Critical transportation supplies could continue. You figure out what you need to lock down, who you need to lock down, lock that part of the community down.
Another little word about vaccines. Another little word about vaccines.
Okay.
So, there is no way out of this pandemic except for vaccination. And I agree that 3 weeks or 4 weeks of lockdown is not going to actually get sorted out by suddenly vaccinating everyone. I mean, that's definitely not the answer. But what I'm saying is, while people's time and energy and health is less affected by the pandemic over the next month, we can prepare on all those fronts. We can prepare for a massive vaccination drive. We can ramp up domestic capacity, import vaccines, forge out deals. We can do the supply chain management of essentials. So we can do all that if we have a breather. Right now, nobody has.
Okay, Dr. Bagai, Dr. Sen asking for a breather for the healthcare workers, for the entire community. They're just collapsing, and therefore a breather would give much welcome respite.
Okay, so what the lockdown is actually going to do is it's going to lock down a society where the society actually needs vaccination. Let's make no mistake about it. The only way we can break the back of this pandemic is through very, very aggressive vaccination. I'm not going into the supply and the demand and the production. Yeah. Now, I didn't want to touch on the deeper part because, but let me break it down for a simple viewer to understand, Rahul. All our understanding so far for the last 1 year was the antibodies were going to protect after the vaccine. That's not true entirely. What is happening now is that the other arm of the immunity, which we call as the cell-mediated immunity, the T-cell immunity, actually kicks in after the 7th day itself. Sooner we start the vaccination, better for the community. Yes, we will reach peak immunity or the expected optimum immunity, let's say 10 days or 14 days or 15 days after the second shot. But worldwide data has shown 65% protection after the first shot itself, 94% protection after the second shot. It's because of the T-cell arm, which actually is a dual supply energy for the immunity. There is a lot of details in it, which is recent publication in the last 4 or 5 days. I don't want to go into the micro level of this to bore the public, but what is important is no lockdown, push the vaccination, recalibrated strategy from a geographic requirement point of view, look at the super spreader events, get rid of those, you will be in control very quickly.
Syed Zafar Islam, you know, at some point in time, if a lockdown is inevitable, by delaying a lockdown, are we then delaying the inevitable? You know, people are lining up in hospitals every single day. I am, and I'm certain that you would be as well, besieged by messages for people who are desperate for help. If they're locked up at home, there'll be lesser interaction, fewer mass congregations, you won't be having elections, you won't be having the Kumbh, you won't be having festivities, and therefore the chain of transmission comes down.
See, Rahul, there are two important things here. First, the Dr. Swain is advocating a breather for medical front warriors. But that breather will actually come to them, but it will bring hardship for the rest of the nation. That is very clear. So a clear-cut lockdown, full lockdown is something which definitely we are not the one advocating it, and we see the pros and cons, the advantages and disadvantages, and the more you think through about it, you feel that lockdown is not something which you should really advocate. Having said that, but there are other measures like putting a restriction, putting a day curfew, putting restriction on congregation, putting restriction on having a 144 in every state. Those kind of measures what one can take emphasizing on containment. These kind of measures you can take. Otherwise, supply chain will be completely disrupted if you advocate for complete lockdown. And the contrary to the perception or the assumption what some of the doctors or panelists have, that lockdown will help us create the health infrastructure, which is not the case. In fact, it will be further bring load to the medical fraternity, because nobody will be able to ramp up either for the vaccination or for creating more medical infrastructure. So it is more important to contain it, but not go for a lockdown, as that is why the Honorable Prime Minister has very clearly stated that that is the last resort.
Okay, so we've heard different points of view. We've got a sense of the thinking currently within the government. We will keep tracking the story, because the weight of medical expertise that suggests that a lockdown is inevitable is growing. Whether it is Dr. Guleria, who's a member of the COVID task force and the director of our most prestigious medical institute, or Anthony Fauci in the United States, who has no skin in the game when it comes to Indian politics, they're suggesting that a lockdown is what we need. But you've heard powerfully advocated arguments on both sides of this divide. It clearly isn't an easy choice for governments and administrations to make. We will track carefully what happens. To my guests for joining me with an illuminating conversation, thank you very much. We're slipping into a break. When we come back, we will focus on what's happening with the IPL. We'll focus on, two players of the Kolkata Knight Riders testing positive for COVID. We'll look at other stories coming in on the other side of a very quick break. Stay with us. We're back in a moment.